Good afternoon, everybody. I am Dr. Aman Salwan here. I am a senior consultant cardiologist at atCARE Hospitals, Nampally. Today, I will be discussing with you about COVID and its cardiac manifestations. As you all know, COVID is a new disease, just came in about 2 years back, and many of the things were not known to us in these last 2 years. But as we have seen more and more patients of COVID, more and more patients coming with heart diseases, now we are a little bit more clear about the cardiac manifestations of this disease. COVID can affect the heart even without affecting the lungs. This is a very important thing to note. It can cause heart attacks, it can cause pulmonary hypertension, it can cause left heart failure, it can cause right heart failure, it can cause renal artery thrombosis, it can cause venous thrombosis, arterial thrombosis. There can be elevated levels of fibrinogen and D-dimer. So all these kind of thrombotic complications have been seen in patients of COVID. We have seen patients who have had heart attacks without blockage in their coronary arteries. This is all because of the elevated thrombogenic potential which this virus creates by causing inflammation in the blood vessels all over the body. So you can actually have heart attacks without blockage in the coronary arteries in patients of COVID. It is very important for us to vaccinate ourselves to prevent these complications of COVID. It is important to take both vaccinations, and if possible, also do take your booster dose. Another very important thing that we come across in patients who are having cardiac diseases is when they come to the OPD, they ask us, Doctor, should we take the COVID vaccine? Yes, it is very important. Whether you have had an angioplasty, whether you have had a bypass surgery, whether you have had a wall replacement, we all need to take vaccination. They think that by giving the vaccine injection, they may be bleeding. No, it does not happen so. There are certain precautions, like you don't have to rub too much on the point where the injection is taken if you are on oral anticoagulant or coagulation therapies like acetron. So just give the injection, keep it pressed lightly for a couple of minutes, and that should be enough. This is one of the very important things. So everybody with heart problems, whether bypass, stenting, needs to take the vaccine. Second thing is, we still need to follow social distancing. We still need to mask ourselves properly, especially when you are going out to public places. Another very important aspect is that cardiac patients are more likely to develop more severe forms of COVID, because most of the cardiac patients also have concomitant hypertension, diabetes, obesity, these kind of things. So cardiac patients are more prone to COVID, and if they get COVID, then the chances of having more severe disease is also more likely. So cardiac patients especially need to be very careful. If they develop any symptoms of COVID, they need to contact their doctor immediately. They need to take home isolation if their lung saturations, oxygen saturations are above 93%, if they don't have high fever, if they don't have severe drowsiness or don't have severe myalgias. They can all be managed at home with normal medications like paracetamol, anti-allergics and such medications. If, however, your fever is not coming down, you are having severe breathlessness, saturation is dropping below 93%, you have severe myalgias, or the patient is becoming drowsy, you immediately need to report to the hospital and get admitted. And if the patient has COVID, one patient has COVID in the house, he needs to be isolated. Everybody in the house should wear mask, and the person who is giving care to the patient should enter his room only wearing a mask, not share the bed sheets, towels and utensils being used by a COVID patient. 95% of the patients now we have seen can be treated at home, and they do not need to come to the hospital if they are in touch with a good doctor who is giving them good care at home. So my carry home message for today's COVID cardiac patients is, you can be managed at home, but you have to keep in touch with one of the doctors who has good knowledge of COVID and who can give you the appropriate symptomatic treatment at home. If your condition deteriorates, you should not waste time and immediately report to the hospital. Thank you.